Is there a side effect of not treating acne? That's what we're going to discuss today. Welcome, I'm Dr. Arthur Colsky, founder and medical director of Advanced Acne Institute. We're a dermatology practice that treats only acne, and we're very unique in that regard. We'd like to share some of our insights and experiences with acne sufferers who are trying to navigate the path toward clear skin. And we hope you find this information useful and informative, but it's only for educational value. This is not meant to be medical advice. So in today's discussion, we're going to talk about something that I think is a consideration when deciding whether to treat or not to treat acne. And that is, we know that certain medicines have certain side effects, and we need to be very informed about those side effects because some of the medicines we use to treat acne are very serious medicines, and they do have potentially significant side effects. So it's very important that when a patient decides to use any medicine, that they consider the potential side effects of the given medicine that they're planning to use and to make an informed decision if they feel comfortable taking that for themselves or if it's a parent for their teenager. But there's another side. There's a flip side to that calculation as well. And that is, what are the side effects of not treating acne? And sometimes this gets lost in the mix because in an effort to prevent any particular side effect from a given medication, sometimes people forget that there's also a side effect of continuing to have acne. And that is, acne can have significant effects on a person's quality of life. It's not just the physical effects. So we're not just talking about maybe the pimples are painful or itchy or uncomfortable, but also the way that it affects a person's emotional well-being. So when somebody is experiencing acne, it can have a profound effect on their ability to cope in life. It can have a profound effect on their ability to interact socially, to feel motivated in their job or at school, to have a good outlook overall because they're very embarrassed about their breakouts. They're very uncomfortable with the fact that they keep having breakouts and they don't feel like wearing the latest fashion because it's affecting their self-value, it's affecting their self-esteem, their self-confidence. So these things can weigh on a person's quality of life as it continues to be an issue for them for long periods of time. It can be very frustrating. And in our practice, we have surveys that each patient fills out to inquire about these particular unseen side effects of acne so that we can get deeper into the process to see how acne is affecting each of our patients. So by not treating acne, sometimes that can be a significant side effect in and of itself because these factors that are detracting from a patient's well-being, emotional well-being, quality of life can continue to occur. And sometimes we have parents, for example, they say, well, when I was a kid, I went through acne and I got through it and it's just a rite of passage and my child just needs to give it more time and it'll go away on its own. And so we have to think about that a little bit more clearly because even though a lot of teenagers do develop acne, it is something that can weigh heavily on their mental well-being. And we have to consider that if we withhold treatment from them, that they are experiencing significant effects in that regard, and we may need to rethink that consideration, even though some patients handle acne well and it doesn't affect them very significantly. There are others who are very sensitive to that, and we have to take that into consideration and be very sensitive to how they might be feeling with this condition. So the point is that while it's true that medications can have serious side effects, and we have to take those very seriously, but it's also true that not treating acne can have serious consequences as well, and we have to take that seriously as well. And each patient needs to consider that and decide for themselves, and each parent as well, for their teenager, has to decide what the best course of action is, but both of those should be considered in making that treatment decision.